Hello, everybody. Welcome to the Hudson Regional Hospital podcast. My name is Dr. Nizar Kifaeih. I'm the president and CEO of Hudson Regional Hospital. Today, we're happy to host with us some of our esteemed colleagues, Dr. Strom and Dr. Rosen in the middle, who are bariatric surgeons. Why don't we start by first telling us a little bit about yourself? We'll start with Dr. Strom.
Sure. My name is Dr. Karl Strom. I've been in practice for almost 20 years now. I did a fellowship in laparoscopic surgery at Westchester Medical Center, developed a program in Northern Jersey at that point, and probably did over 10,000 surgeries in bariatric surgery over that course. Wow. So it's exciting to start to continue this venture here at this hospital.
Thank you, Dr. Rosen.
My name is Dr. Daniel Rosen. I've been in practice a little shorter than Dr. Strom, which means I haven't done as many cases. My practice is split between bariatrics and hernia mostly, but my main passion is bariatric surgery. Just watching the transformation a patient can go through, being part of that journey from the very beginning, and watching these patients really find the inner person that they are, that they've been waiting to have come out for so long.
But why don't we start first by telling some of our listeners here what is bariatric surgery? So maybe we can start with you, Dr. Rosen.
Sure. Bariatric surgery is universally known as weight loss surgery, and it's basically surgical procedures that we do that alter a patient's anatomy in some way, either by cutting the stomach or rerouting the intestines or some combination of those two, which allows a patient to eat less and get fuller sooner. And the result is that over a time period of 6 months to a year and a half, they lose a significant amount of weight.
Now, if I'm one of the people who are listening to this, my first question would be, when should I seek a consult for bariatric surgery?
Years ago, we used to look at a patient in weight in pounds. We don't do that anymore. Now we look at somebody's BMI, your body mass index. Somebody is considered severely overweight if their BMI is over 25 to 30. But a candidate for this is 40. That's about 100 pounds over your ideal body weight. And you use your height and your weight to make that calculation. We lower that threshold a little bit if you have comorbidities, such as diabetes, hypertension, sleep apnea, severe reflux, joint pain. Then we bring it down to a BMI of 35. That's about 75 pounds over your ideal body weight.
How does someone figure out what their BMI is?
Well, today it's pretty easy. You can look on your phone and find the calculator, to look at your height and your weight.
Or Google.
Yeah, exactly. Also, during your physicals, your yearly checkups, your doctor's also going to educate you about this too.
One of the questions that our listeners may have is, what are some of the prerequisites or requirements for a patient to be considered for bariatric surgery?
This is a broad question. Because I think in terms of who's a patient for bariatric surgery, the insurance puts pretty rigid requirements on it. So in terms of who decides whether they should have bariatric surgery, I think it's really, are you someone who's a higher weight than you want to be? And are you starting to suffer the side effects of being that heavier weight? Then there's a lot of options that bariatric doctors like Dr. Strom and myself can offer them in terms of all the different bariatric surgeries, and there's a range of them. And some are better for the very, very obese, people who are 100, 150, 200 pounds over their ideal weight. And then there are different surgeries that are better for someone who's 40 pounds, 60 pounds overweight.
Obviously, you individualize the care based on the patient, based on what's best for them. So once you interview the patient, you get to know them, you can select with them what's going to work for them.
But let me tell the audience a little bit what a sleeve is. The sleeve basically is, in the purest terms, a restrictive procedure. Instead of eating a dinner plate, you're going to tolerate a salad plate and be satisfied with that. And how we achieve that is we divide the stomach into a very long, narrow column. It looks like a banana. There is no insertion of a sleeve. There's no foreign objects. You don't change the lower anatomy like you do in the gastric bypass. So there is no malabsorption, so the vitamin deficiencies aren't as severe. You do remove a portion of the stomach that you reduce, which has some hormones that we could go in later that affect your hunger. In doing so, these patients tend to lose about 60 to 70% of their excess body fat in the course of this procedure.
Wow. Obviously most patients will read about this and will listen to you physicians talk about this, and they have certain expectations in mind. So when you see a patient, and obviously again, we talked about how you individualize the care of the patient. what sort of expectations do you set them up for from the beginning and over what kind of period of time?
Yeah. So what I do is, first of all, I tell patients this is a marathon, not a sprint. Because of a lot of the roadblocks the insurance company puts in, including the fact that you have to be there for 6 months of monthly visits, it varies from insurance company to insurance company, but that is something that's standard with a lot of them, that they need to sort of be motivated for the long term to get this surgery. And then they have to be motivated after the surgery to have the best possible outcome.
So the battle doesn't end once you have the surgery.
Exactly.
No, we help them. That's the key. You know, they've been struggling with their weight, and also the comorbidities are starting to come on as they get older. You know, as the weight comes on, then the hypertension comes, the diabetes, you know, the sleep apnea. So in that process, as Dr. Rosen was saying, the first portion of it, we prepare them for what life's going to be like after surgery. Then we provide them the resources not only to lose the weight, but to maintain that weight for life.
Yeah, nutritionist, psychologist, the surgeon, we all sort of form a comprehensive, holistic team.
Why is that important?
Well, because what I do for the patient, other than a little bit of moral support along the process, really begins and ends in the 2 hours I'm in the operating room with them. You know, what they're going to eat on a daily basis is really coming from their nutritionist. How to deal with some of the psychological issues assigned to food that they have since they were a kid is really for the psychologist to sort of break down.
Can you maybe go over, Dr. Strom, the different components of the actual team that takes care of the patients before surgery
Sure.
and then potentially after surgery?
So before surgery, we want to make sure it's safe. So our patients are seen and cleared by a medical team, which consists of an internal medicine doctor or a family practice doc, cardiologist, because we want to make sure their heart's strong enough for the surgery, a pulmonologist, we want to make sure their airways are
That's
safe.
the lung doctor.
Correct. To make sure their airways are safe. And a gastroenterologist, because we want to look at the inside of everybody goes through what's called an endoscopy. We want to look at the inside of the stomach and make sure there's no hidden surprises.
Pre-existing diseases
Correct.
or other issues.
Ulcers,
Sure.
correct.
Sure.
So they go through a very extensive, and which is great here. Once again, I'll keep on telling you about the hospital that we have here. We have that program right here at the hospital. So it's a one-stop shop. They get referred to the medical clearance team. They get seen by all these specialists, and we make sure they're safe to undergo the surgery.
Sure. Obviously, we've all have come across some patients who have had some sort of bariatric procedure before, and maybe have not seen the results that they're happy with. Do you do any of these procedures that are called revisions?
A lot of times patients have been given a surgery that they thought they wanted, but it didn't really achieve the goals that they were looking for. And so you can really revise almost every bariatric surgery with different degrees of risk. And that's really the key. Understanding the patient, knowing what their risk tolerance is, getting the best revision for them that minimizes that risk and maximizes the potential outcome for weight loss.
So basically what we're saying is, if you've had a procedure before and you haven't seen the results that you really were hoping for, don't be discouraged from
Come
seeking
see
a
us.
consult.
Yes.
Come see us.
Because
Lots
there are
of
potential
options.
solutions there.
Yeah, and don't feel ashamed and don't feel like you failed the surgeon. A lot of patients, when they start to regain weight, they stop coming in because they don't want me to be disappointed in them. And that's like the time you need to come in, because we can help you navigate.
So that takes me to another point. Maybe Dr. Strom, you can comment on this. What sort of expectations should the patients have post-surgery, and over what kind of period of time? We talked about before. Let's talk about after.
Well, like Dr. Rosen said, it's a marathon, okay?
Yes.
So you're gonna see the most dramatic weight loss initially, but it's gonna be consistently over the next year or two.
So should I eat whatever I want, or?
No, well, we're gonna have our dietitian work with you. Okay, obviously, you're gonna prepare before the surgery, so you're gonna know the requirements and what it takes afterwards. The first 6 weeks after surgery, we have a very regimented diet that you'll be on. Afterwards, yes, you'll be able to more expand your palate and eat a little bit more, choices. But at the time frame, you're gonna see weight loss not only in the first 6 months, but you're gonna continue to see that throughout the whole year.
So, we feel a tremendous sense of camaraderie with these patients as they go through this journey, and we want to be there with them, and we really want to see them succeed.
And it makes us happy in our field. I mean, it's,
It must be very fulfilling for you to see patients do very well.
The best thing I tell the story is everybody's like, why'd you become a bariatric surgeon? It's because of the relationships that you develop with your patients.
I'm sure the self-confidence changes a lot of
and
things.
then you
change.
see, like, I'm sure that you see so many of your patients that were bad diabetics, and all of a sudden they don't even care about the weight that they lose. I'm like, excited, you lost 30 pounds, this is great. They're like, doc, I'm not on any of my meds anymore. The weights, just.
I'm glad you mentioned that, because my next question was in terms of patients who have, weight challenges and they undergo through the surgery, what sort of expectations they should have in terms of the impact on some of the medical issues that they may have from before, like diabetes, like I mentioned, like hypertension, maybe other issues, obviously sleep apnea and things like that I mentioned earlier.
You could, it's amazing how you see the resolution. Like I said, the diabetes, that's usually we see that sooner. That's one of the first things that starts to resolve is the diabetes. And usually sometimes from the day that they go home after surgery, they're not on their meds. The hypertension in a couple months, the sleep apnea usually a little later, 4 to 6 months.
One of the things that we have is the Institute for Robotic Surgery, which is really geared more towards minimally invasive surgery for a lot of different types of patients, and one of which obviously is bariatric patients. There is laparoscopic procedures and there is robotic-assisted procedures, and we have one of the most advanced robots in the world here at this hospital. Can we maybe comment just for a couple of seconds about the benefit of having minimally invasive procedure, laparoscopic and robotic-assisted?
I feel, today, any minimally invasive surgery, robotic or laparoscopic, is the way to go.
Oh yeah.
Okay, compared to a big incision that you made years ago, we don't do that type of surgery anymore. Little incisions means less pain, faster recovery, and faster
less complications.
We don't even do that in this hospital.
Blood loss.
Like we don't do weight loss surgery in this hospital that requires a big incision. Every surgeon here will do laparoscopic or robotic.
Here at this hospital, obviously, we provide some of the cutting-edge technology, the most cutting-edge technology. And the way I look at it, and some people have heard me say this before, we're providing great tools in really capable hands, right? So at the end of the day, it's really about the skill set that you have and the skill set that you have. Obviously, what you use to get to a certain resolution or a product is based on what you have as a skill set, as a surgeon.
Yes, innovation, that's what it provides.
Yes.
Robotic just provides innovation and competition within their own medical device world and makes it more safe as we go along.
Yes. Just like you individualize the approach to the patient's care, these tools and instruments can also help you even individualize further what you can do for the patient. Now, for some of our listeners that are listening out there, in terms of why should they select Hudson Regional Hospital for bariatric surgery?
Why I like taking my patients to Hudson Regional is the experience that they get from day one. As we were talking about throughout the whole program, you need to have a pre-op clearance. And you put together a team here of a clearance program that they can come just here at Hudson Regional. In order to have the clearance, you need to see a medical doctor. We said a cardiologist, a pulmonologist, a gastroenterologist, and we have all those docs under one roof.
And a sleep lab.
And a sleep lab right here. Otherwise, you're gonna have to go see your cardiologist at a different location, a different time. You're gonna have to go see your GI doctor at another location. You're gonna have to make an appointment, call for all these appointments, have to schedule them yourself, try to coordinate all this. It gets to be a little bit burdensome. So the program that we put together here incorporates all that under one roof.
One-stop shop.
Correct.
Under one roof.
And patients love that.
And with the best docs available for them to clear these patients too.
I mean, it makes it a seamless process for not only for the patient, honestly, but for you as the physician who has to take the patient through that process.
So my practice is in northern Jersey mostly, but also in Manhattan and the boroughs. So I have patients that I bring to Hudson Regional Hospital and are happy to come to Hudson Regional Hospital from Queens, from Brooklyn. And the great thing is that their transportation can be facilitated. If people have problems getting here, the hospital can help arrange transportation so that they can get here with less stress, for their surgery day. It's always nice when a patient can come in and be relaxed and not have to worry about all those things so they can focus on the job at hand, which is to get through a surgery.
Is there anything that you want to add before we say goodbye to our listeners?
I want to say that if you're thinking about having bariatric surgery, talk to a doctor who can walk you through the details of bariatric surgery, like a bariatric surgeon. Just starting the process doesn't commit you to anything, but opens up the potential for everything.
Yeah, I always ask my patients, what would you tell somebody? And they always said, I wish I didn't wait so long. So that's the key, okay? Don't wait.
Dr. Strom, thank you so much for your time. Dr. Rosen, thank you so much for your time. And for our listeners, thank you for joining us for another Hudson Regional Hospital podcast.